Hi, everybody. It's Olivia Scott with Freedom at the Mat. So today we're going to have a very important conversation. We all know that our world is in a very uncertain time. Medicaid is in jeopardy. And many of us, whether we're self employed, underemployed, or just, insurance is unreasonably expensive for us, we're looking for ways for us to find new alternatives to insurance and healthcare. So I am joined today by an incredible woman that I met at Black Health Con. Shout out to Black Health Con. Nzinga Lowe. She's a dynamic woman who is a leader in the healthcare industry. She's the founder and CEO of Pygmalion Health, and she is here today to talk healthcare and alternatives with us. Hello, Nzinga. How are you today?
Hey, Olivia, I am doing great. So happy to be here. Thank you so much.
Thank you so much for being here. So let's get right into it. So,
Yeah.
given that Medicaid is in jeopardy for so many people,
Mm.
right? Will you enlighten the Freedom Act community regarding alternative healthcare options such as direct primary care? I was fortunate enough to have found my DPC, direct primary care, here in New Orleans a few years ago, and it has changed my life. I do not pay monthly insurance. It's not quite insurance, but I kind of patch together some things where I've got urgent care, but I've also got her every month. But I'd like for you to share with people what is direct primary care and explain how it works.
Yes. Thank you so much for this question. And I'm so excited to just shed some light on this space. So, direct primary care is, like you said, a subscription based model. You pay a flat fee every month. And what's great about it is when you add it all together for all of the things that you paid across the year, it is sometimes or most times less than what you would pay in a deductible. And given that you're able to see your primary care physician for a longer length of time, because within that DPC space, physicians aren't held to this time crunch. They're able to dedicate more time with their patients. And then even work in programs where they can get you your prescriptions for a lot less, some as low as $8, where you're paying $20 to $40 for that same prescription. So under this model, you're not confined to what insurance holds you against, especially if they're not going to cover certain prescriptions. But DPC is an amazing framework where you can actually see your provider for as low as $30 a month, all the way up to, if you are a family, 100, 120 a month just for the collective. So,
Can you
yes.
tell people how that works, though? Because it sounds a little too
Yeah.
good to be true. And I'll give you a little quick anecdote for anybody
Yeah.
listening. What is Olivia? What are we talking? What's in What are they talking about? I divorced, no longer had the insurance, self-employed, freelancer, was looking in New York at $500 a month and was like, I gotta figure something out. Called a doctor, a friend of mine, happened to have a friend who was a doctor, and said, I don't know. Do I choose between this one, this one? They were all ranging between $400 to $500. And she was like, you should look for a DPC. And it felt too good to be true. I'm just a regular girl from Memphis, like trying to live my best life. And I looked at it and I found there were several in New Orleans and I pay $75 a month. And you're right, I pay $8 a month for one of my prescriptions. So tell us how they work though. For those who are skeptical, it's like, because I have a friend who was recently laid off and I told him, I said, you should look at, and he's like, oh no, I gotta go with XYZ. You gotta stick with the insurance, right? So tell us how they're able to offer the care they do at the low rates they do, and even the prescriptions being $8 versus 30.
Yes. So a lot of DPC physicians are kind of bridging out of this space where they're tired of having to deal with insurance companies, or they're wanting to open up an alternative model of care, so that they are able to serve the patients that, one, are entrepreneurs, are having trouble getting on Medicaid. So through programs and through leaders within this space, they are able to enter into this and offer this hybrid model. So if you, like you said, if you do that research, go online, we're able to find some incredible Black, brown, diverse physicians, both female, male, whatever you're looking for, that are able to serve you and actually give you the care that you need. And it's all from a model that they're learning within this DPC network. So physicians are actually becoming more well versed in this space, and it's constantly growing to where it's a hybrid model. But there's also spaces where they solely focus on direct primary care, and it's all through these physician led programs. I am the founder of Pygmalion Health, and my focus is on bridging the gap for physicians that are in this space trying to enter into direct primary care to offer this to their patients to make it more accessible and successful. So, always able to support physicians in this and answer any questions they may have.
Yes.
But for the individuals that are actually looking for a great DPC physician, definitely utilize Google. There are some amazing physicians out there. I'll name a couple. We have Michelle Cook in Atlanta. We have Dr. Keisha Rowe that is in Texas. There are a long laundry list of credible physicians. And the great thing about direct primary care, you can actually do it virtual. So telehealth is always available. So if you can't access a physician in your area, you can always connect with them to see if they offer telehealth within your area.
Bless you. Okay, so now
Yeah.
thank you for blessing us with that information, right? That's one of my burning things that I'm so excited about having found that I want to share with others, but I don't have
Yeah.
the language. So thank you. So let's talk about you, right? So
Yeah.
you're the founder and the CEO of Pygmalion Health,
Yeah.
which among many things measures chronic healthcare issues through innovative prevention initiatives. How do you do this? And who do you serve most? And tell us also your why. I'm really curious about what exactly you're doing and why you're doing it. It seems so innovative and so relevant.
Thank you. Yes. So, Pygmalion Health really is a healthcare advisory firm that was built on the premise that when doctors prosper, patients thrive. So, really, my focus is on equipping physicians and healthcare leaders with the resources they need to succeed in a changing healthcare landscape. So, really, making sure they understand all the options. So, we're so structured on this space of insurance and making sure that we're aligning with physicians that cover our insurance, or physicians are worrying about what insurances to take when there are so many alternative models. So, like we mentioned, direct primary care, value based care, longevity medicine, precision medicine, all of these avenues to start focusing on the patient as a whole. In an individualized approach to care is truly what it offers. So, looking at the patient holistically, social, physical, economic aspects that affect their care, and causing communities to improve their health outcomes overall. So, what I do is I work with health systems and medical groups and just advancing how they approach care in multiple care delivery models, like I mentioned with direct primary care, in their hybrid models, value based care, longevity medicine, and precision medicine. But I also have two initiatives. So, Optimum, which is a care network that I'm building to create a network for physicians to connect with vendors that are in the space to improve patient health outcomes, whether it's through digital therapeutics, food and transportation services, just any ancillary services, and even mobile urgent care units. So, all of this is available to physicians if they want to expand their offerings and to connect with patients on a deeper level. And then I have the Health and Impact and Care Innovation Initiative, which is really focused on connecting me to the community, connecting to the churches, to the community centers, to the leaders, the community health workers, and the leaders in the space that are trying to improve care to make sure that patients and communities understand what is out there and available to them. Because I think the one thing that keeps patients from improving their care is lack of information, or the plethora of like disinformation and misinformation, and making sure that one, they understand what resources are available to them and increasing their autonomy. And for the patients that may not have the ability to be as autonomous as they want to be, making sure that they have the resources to at least give them the support that they need. And that's really the premise behind it. And my why is just because we're in a space now where we have to be able to care for ourselves. And if we can't care for ourselves, finding people that want to care for the community. So that is my passion, equipping all of us with the resources to build healthier communities and healthier populations. So no matter what is happening in the government, in just the changing landscape of care, we have all of the resources that we need and we have access to all of the amazing innovations. It's not coming to us 20 years down the line or 10 years down the line, but it's available to us now.
You know, there's a quote that I'm going to completely flub, so I'm even going to try it. But the point of the quote is that when you live a life that is servant driven and is about being a servant leader, you bless the entire world. And in listening to you and your passion and your sincerity, and I've been to your website, I've met you, I've seen you at Black Health Con. This is a real, for all my freedom ads, this is somebody who is really living out their passions and is really servant leader driven. So I'm just honored to be in conversation with you and to learn more. And I'm hopeful that more physicians will contact you from this conversation. I'm also hopeful that more people will begin to consider direct primary care and also taking better care of themselves. As you said, we have to figure out how to do it for ourselves, whether it's creating our own vegetables and fruits and like eating from the land, we got to figure it out. So now you just referenced something, which is the value of physician and patient autonomy.
Yes.
Explain that a little bit more, and can you explain how we as patients ourselves become autonomous?
Yes. So, how I like to think about it is when we understand the patient may have had an experience where they don't see their care as being paramount or important, but we have to change that mindset. How I like to see it is that the patient, and I compare this to sports. So, for any sports fan out there, like, please forgive me because I am not well versed in football. I think that everybody is Kobe Bryant and I don't know anybody else. So, and I'm just like, go team. But really, the patient is the owner of that team. And if we're thinking of this from a football landscape, the patient is the owner. The primary care physician is the coach, is the main leader of that team. And the ancillary physicians, the specialists, the resources, the food is medicine leaderships, the community gardens, they are all the critical players. So it is important that one physicians understand that they are leading what care looks like for that patient, and patients understand that they are the owner of what that care looks like. So if patients start to become autonomous in their care, they're equipped with the resources, they understand the power that they have to change their care, to be surrounded by community leaders, by friends, by family that can help support them in that space, health outcomes start to improve. Autonomy is attractive to a lot of us that have been told that our health outcomes don't matter, that the issues that we're constantly presenting to physicians that may not have cared in the past, that they are important, that they are legitimate. And when we start to increase the information, when we start to share the legitimacy within the concerns that Black women, Black men, that all individuals and within the minority space are constantly presenting about health issues. When we start to create collectives that focus on improving their care, that's when we start to improve the health outcomes of individuals. Our healthcare system has never focused on that. And most times you hear that the healthcare system is broken, but there's nothing broken about the healthcare system. It's operating in the space that it has always been put in place to be. It's really about us reimagining what care looks like, and that's in equipping patients and physicians with everything they need to succeed in improving care. And really, the minute that you start to do that, that's when we become a more informed population.
Thank you so much for that. And
Yeah.
that does lead me into a question I have because are considered to be a healthcare futurist. It's such a beautiful term. If you were to imagine a brighter healthcare, what would it look like? And I would say healthcare industry, healthcare, however you want to approach that. If
Yeah.
you were to reimagine healthcare differently in the United
Yeah.
States, what would that look like?
Well, it would look like a more holistic approach to care. I think our healthcare system has focused solely on treatment. It's time for us to prioritize prevention.
Ooh.
We've seen patients as statistics. We've limited the access to information that certain physicians have, especially if they're in rural or urban areas, especially if they look like us or come from different backgrounds. It's time for us to make sure that physicians are well equipped with longevity medicine specialties. And I can definitely go into what longevity medicine actually
You know
is,
it's
but
coming next. It's coming next.
it,
So you
it
might as
has
well,
to.
like,
It
listen,
has
just go
to.
for it because it's like I want to get
Exactly.
there, but I'm just like, I have so many other
Yes.
questions for you. Yes, definitely. I want you to get there, but I also
Yes.
want you to tell us what it looks like. And I'm sure it includes longevity medicine. So I'll be quiet.
Yes. No problem. It's time for us to emphasize what individualized care looks like for patients. We can't just focus on treating every patient the same. We're seeing them as statistics and as collectives to where we treat them the same. We need to understand the holistic issues that are going on within that patient's life. The fact that that patient is working two jobs, trying to manage taking care of themselves and taking care of their families. We have to think about the fact that these patients are trying to figure out alternative ways to eat healthier food and that they're battling with the fact that they don't have enough time in the day. We need to start making care holistically approachable and easy. And we need to start prioritizing prevention. And that's exactly what precision medicine does. And from the longevity space, it is a multi-layered framework and happy to go into that that causes us to actually look at care from the fundamental level of diet, sleep, exercise, nutrition, and having physicians that prioritize that. Us understanding the fact that patients are dealing with the fact that they're trying to also find jobs. And in a space where people are losing Medicaid, they're having to deal with unemployment. What does care look like? And how do we connect them to federally qualified health centers that support patients that are dealing with job instability, housing instability, and even with housing instability? How are we supporting communities to improve their access to housing so that their health outcomes actually improve? So, in the future of healthcare, I see it being something accessible where not the top 1% gets to live longer and have access to the most incredible care, but with all physicians being in this space where they're leading care initiatives from the rural space, from the urban space, from every part of the US and internationally, and making care more approachable for all of us because it's not some foreign territory that we should be confused by. We shouldn't be in a space where we're just waiting for a prescription to be handed to us or being okay with the fact that diabetes, cholesterol, hypertension are all multi generational conditions that are just going to come to us in a matter of time. We need to be more proactive in this space.
So when you say longevity medicine, it's
Yes.
actually not a pill, it's not Botox, it's not some treatments I can go pay for.
Mm-mm.
It's the
No.
integration of wellness.
Yes.
You know what? It's so interesting, and I appreciate you explaining it to me because I was like waiting for you to tell me that there was something that the real wealthy people were paying for that we could, enlighten our Freedom Act community around longevity medicine. But I smiled earlier when you shared that you really want the industry to shift from treatment to prevention because I've been in this wellness life for a while. And one of the things, even from childhood, one of the things when I began working in it more formally that I began to try to define is what's the difference between health and wellness? This term wellness has become very popular these days over the past 15 years. Wellness this, wellness coaching, wellness this, whatever. But then you also sometimes just do an ampersand, health and wellness. And so I've been spending some time trying to define wellness. And, Freedom at the Mat is a wellness platform, which is really all around making sure that we encourage women to properly do self care and take
Yes.
time for it. And I believe that that is we're saying the same. It's that self-care, that prevention, that eating well, that knowing
Yeah.
what your body is saying, knowing when you're feeling tired, knowing when you need rest, knowing when you need
Yes.
different things so that you're honoring your wellness. Not to, I just want to honor and to say, like, I'm glad to hear that you're aligned with prevention.
Yeah.
And I understand there's some things that hereditarily that many of us suffer from, some autoimmune issues and those things. But when we get into the chronic health concerns many people have, a lot of those things, as we know, are preventable and they come through diet and nutrition and lack of movement. So I'm glad to hear you say that. Anything else you want to add? And I just kind of took over.
Oh,
Sure, Melody.
oh no, 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 no. I welcome this discussion because you are extremely right. And how I like to see wellness is the work that we're doing outside of the traditional care space. Like you said, that's self care. But what we don't understand is that self care is what is increasing our lifespan, improving our quality of life in this space. So everything we're doing to take care of ourselves, no matter how small it is, even if it's just walking outside for 20 minutes, getting some sun, that's improving our care and our quality of life. And just to kind of go a little bit deeper into what longevity medicine is,
Please.
um, there are a lot of leaders who will frame it within the idea of a pyramid. And at the foundational layer, you're looking at those lifestyle interventions. You're looking at the foundation of care. Then we move, and that's, like I said, diet, sleep, exercise, um, all of these aspects. Then we move into supplementation. So, all of these natural herbal supplements. We move into any type of therapies, from peptide therapies to IV infusions. Now, this is a little bit more expensive, and then also wearables. So when you're starting to think about the Whoop and the Aura Ring and all of these amazing devices, but if this isn't something that you can afford, I think it's always important to level set and state that the foundational layer is the most critical, because you can have access to all of the resources, but if you're not focusing on your diet, your sleep, your stress levels, then all of the shiny new technology that you're using is worth nothing. So on the third level, we start looking at optimization. So that's plasmapheresis, red light therapies, all of these different forms of therapies. And then at the top level, that's advanced therapeutics. So stem cells, gene therapy, and across that pyramid, you have things like different types of genomic testing and pharmacogenomics. And pharmacogenomics is very interesting because it's becoming more widespread. And that's really understanding how our individual bodies metabolize the prescription drugs that we take in. Because when we start getting into this space where we're getting all of these prescriptions from our physicians, not all the time does it truly work for our body. And then when it's like polypharmacy, where we're taking so many prescriptions where they might be contraindicative. So it's about understanding really how you as an individual um, operate within this care space, how your care is either helping or hurting you. And once we move into a space where this is more widely accepted, where we focus on the patient as an individual and take more time to focus on the individual, that is when we're going to start to improve care. And I think longevity medicine is amazing right now. It's really for the individuals that can afford it. But my passion at Pygmalion Health is making it more accessible. So all physicians, regardless of the space that they operate in, whether they're in the smallest of rural areas or they're in urban areas where patients may not have the funds to afford this, making it so it is accessible so all of us can benefit from improving our quality of life and our span of life.
Yeah, I have one more thing to say before I ask my final question of you.
Yeah.
You know, it is an atrocity, I think, that longevity medicine, the baseline one, you mentioned the diet, nutrition, sleep, that is something that's not available to everybody. Right? Because as a baseline, that prevention of just like going to sleep, having enough water, having fruits and vegetables, it's not because, of job availability, people having to work multiple jobs in terms of diet. We all know that the packaged foods with all the sodium are much cheaper than going and
Yes.
getting fresh produce every day or every week. So I appreciate you grounding through that. So thank
Yeah. Yes, of course. And I will say this, and don't mean to cut you off.
Phew.
There are so many community gardens and so many food services that are popping up to make access to these resources more available. And I'm so excited. I'm happy to share that separately for your community of all of the amazing resources, and definitely can send that over. But I want to make sure that how we're approaching care for ourselves is something that is affordable and is not scary or something that we push off.
Yeah, that's where like Freedom at the Mat, our tagline is for women who need a moment.
Yeah.
And our point is like we serve busy women, all
Yeah.
ethnicities, all ages, all socioeconomic, because women, we rule the world. And
Hmm.
just it's a luxury many of us feel, contrary
Yeah.
to the beautiful quote by Audre Lorde, many of us feel that it is a luxury. And it is not. It's something that we all should be doing every day, like small rituals, whether it is bathing or washing your hair or the way you wash your dishes or going for a walk. Like you can integrate self care rituals into your life every day. I walk every morning, pretty much every morning. And I'm like, as much as I work out, I should definitely be rail thin. I am not. It is more of mental health thing for me just to go away, put the phone away, and just focus on whatever comes to my mind. And I love how when I wake up in the morning after a really restful sleep, how I'm clearer about next steps I need to take. I think we all have heard in our lives, let me sleep on it, right?
Yes.
But as I move from New York to New Orleans and I live in a more peaceful
Yeah.
environment in New Orleans versus Harlem, I wake up and all these thoughts are just with me. And that's because I've had a solid 8 hours of sleep,
Exactly.
interrupted. And I wish that for everybody. So with
Yes.
coaches like you, I know we're going to get there.
Yeah.
The other
Thank.
question we have for you today is, are there any other specific steps that patients can take to best manage their health other than balanced diet, exercise, and regular doctor visits? Is there anything else that we could be doing?
Yes. First, I would like to say this. I want to make sure that everybody understands that nobody knows you and your body better than you. So, having to make sure that we are building advocates in this space, not just for the community, but for ourselves. And I would say, just to finish this all up, the most essential thing, really, to improve your health is community, because loneliness and social isolation is at an all time high, where so many people are feeling just isolated and not having that community. And perception is key. But how we start to connect with individuals, especially those that have the same focus and goals and alignment and wanting to improve their care and wanting to do things that add peace to their life and just really prioritize their wellness, that is going to transform how we see ourselves. So, really building an amazing aligned community is so critical, because we shouldn't be in this journey alone. And we always hear that quote that if you want to, go far, you go alone. If you want to go further, you go together. And it's so critical, not just when it comes to the idea of business or just projects or anything. It's about building true communities that keep us stronger and healthier.
I had to come back on the screen because I'm like, if I hear this thing about community one more, it is so resounding. Literally,
Yeah.
the number of times I'm hearing this from everybody. And that, you know, I hope that for people who are listening, that that will feel more accessible, maybe even than diet, right? If
Yeah.
you were just completely connected, like I tend to be to my donuts, or my Laffy Taffy, you know what I'm saying? I'm stuff like, oh, diet, whatever. Here we go, another diet, nutrition, another diet, and you have to work out. But you're saying, listen, just find some friends. And I think what's important that you said that I'd not heard before in Zynga, which I really appreciate, is not just community, like you live somewhere and go out and hang out and sit on the porch, but communing with like-minded people,
Yeah.
which is grounded in, okay, what do you want in life? And
Hmm.
figure out what you want in life, then how can you find your tribe? Your vibe attracts your tribe. So
Yeah.
being able to connect with like-minded people and feel that you're in this with other people. And
Yeah.
one other comment I want to say is I do find it fascinating, and I know that I'm not the only one or the first, that finds that even with all of these connected networks, these social communities that we have, that we are at a worse place mental health wise. I think, now that families can send their children to go to college around the world and people can choose to live around the world from their families. This is something that wasn't available. Back in the day, if you grew up in Memphis, you were raised in Memphis, you went to school, you born and died in
Mhm.
a place. Now we can go anywhere we want to, but now we're lonelier.
Yes.
So it's
Yeah.
like, how is that
Yeah.
working out?
Yes. So for me, and I did want to also add that mental health is going to be critical. So connecting yourself to a mental health professional, a therapist to support you and to give you the support that you need, especially as you branch out. But like you said, we're entering into a digital space where it's making up for the fact that we are miles or time zones away from our loved ones, our families and friends. We're being uprooted, and even we can be a block away from our family and friends and still feel isolated.
Right.
So it is about really making sure that one, that there is access to amazing therapists through various resources that can see you virtually, and building those virtual communities. I think we understand that how we navigate one, our own care, but also just our day to day lives, it is critical that we have a sounding board. We are people that thrive on community, and that's making sure that we have those. Resources to build those communities. And there are amazing groups. I found out that when I moved to Atlanta, that there was a Facebook group that you could access to connect with all individuals that had just freshly moved to Atlanta. So those resources are out there, those communities are out there. So when you move to new spaces, find out how you connect with other individuals that might be new to those spaces. I think just to echo what other countries are doing, Japan has a great way to reduce the level of social isolation and loneliness, where they actually build communities for those that might be new to the area in Japan, and they build those groups where they go out and they do activities together within the community, getting them comfortable with the different areas of the cities in Japan that they might be in. So how we start to look at how other countries are improving the health outcomes of their population, we can start to emulate that within our spaces to build more communities. And even Freedom at the Mat, that is an incredible community
Yes.
that you've built to actually connect women everywhere on resources to help them improve their care, not just, from this health standpoint, but from this wellness standpoint. So these are amazing virtual communities that I think need to be amplified and uplifted, especially when we start to just amplify our own self and our own care.
Awesome. My
Yeah.
last question of you is how can the Freedom at the Mac community, how can we support you and Pygmalion Health?
Thank you so much. Yes. All I can say is you can connect with me on Pygmalion.health. That is my website if you would like to learn more. I am also on LinkedIn and Nzinga Lowe. You can find me there. Any questions that you may have, whether you are a physician, a care provider, or a healthcare professional, or even just an individual interested in learning more about everything that I've discussed, please reach out to me there. I am happy to answer all questions. Outside of that, my focus is making sure that more communities have access to resources. So, any resources I can provide, please let me know.
Fantastic. Thank you so much, Nzinga. I mean, you are one of the nation's finest, one of the 40 under 40. You continue to win awards. You continue to lead us all. And we are so grateful for your life, so well lived and so passionately lived. So may God continue to bless you.